It's been 10 days now since Newfoundland and Labrador sent medical workers to Ontario to help out in some of the most overwhelmed hospitals. The first team, of course, had a notable addition. That would be Dr. Allison Furey, an emergency physician who is also married to Premier Andrew Furey. Now, Dr. Furey is part of a 9-person team deployed to Toronto's University Health Network. She joins us now to talk about what the experience has been like. Dr. Allison Furey, welcome to the show.
Thanks. Thank you for having me.
So tell me, what's it like to be in an Ontario hospital right now?
Well, the hospital is very full. I will say that the hospitals are full and busting at the seams, which is something that we're not used to in Newfoundland, and I think probably even here they're not used to. So it's ever expanding.
How does it compare to past experiences you've had? I know you've done work, field hospital work internationally. Obviously, you've done work in Newfoundland and Labrador. I mean, how does this experience compare to your experiences in those other places?
Well, I mean, we're in Canada, so the first most striking thing is that we're dealing with a system that is not normally overwhelmed. That's overwhelmed. So. The biggest difference is that I'm working with my colleagues in our country, and I think that's kind of scary.
So you've been there, what, 2 weeks now? Is this the end of a 2-week stint for you, just about?
Yeah, this is like 10 days. So yeah, we got here.
Is there one specific thing that stood out for you in your time working there?
Well, yes. There's a couple, but the first one is that the healthcare workers in Ontario are the true heroes in this pandemic. They have risen to the challenge, and they've really stepped up to the plate. And although they're tired and probably wish they weren't in the situation, but they've really stepped up to the plate. So it's been an honor to work with them. And with regards to the patients that we see, they're really young. They're young, otherwise healthy people who have, contracted this virus, and they're really sick. And we're not used to seeing such young people be so sick.
When you say young, I mean, what are you talking, 20s, 30s, 40s, all of that? I mean, the first and second wave,
Yep.
it devastated people in long-term care homes, but the dynamic of this one is so completely different. So, I mean, when you say young, what exactly are you talking about?
Yes, 20s, 30s, 40s, and 50s. Yeah, so young.
I know back home in St. John's, you've been working with COVID patients sort of since the beginning, but obviously it's been a very different pandemic in Newfoundland and Labrador than it has been in Ontario. From a hospital setting perspective, how do the situations compare?
Well, my experience in St. John's has been more with ambulatory COVID patients, but we have not seen the relative volume of COVID-19 patients in St. John's that they are dealing with here. So although we have had some severe illnesses and some deaths from COVID-19, it's certainly not to the same scale.
So in your view of where things are right now, obviously the fact that you're here tells us something about the Ontario system, right? So based on your 10 days of working in the system, what does Ontario need right now? What does the Ontario health system need at this point in time?
Break. No, they need. I think that they need help. I'm not positive that I know exactly what they need, but they do need a break, and they need some relief from this virus.
You're in Toronto Western, right? That's the hospital you're working in right now. In the 10 days you've been there, I mean, we've seen the case numbers, thankfully, bend down, right? The number of new cases is declining. But, the situation in the hospital often there's a lag from when the community situation gets better and when the hospital situation gets better. What's your sense of the situation in your particular hospital? Has it gotten worse? Has it gotten better during your stint? I mean, what's the trajectory that you've been able to see in your time there?
Well, right now we've had last week we had a lot of admissions to our team, and this week we're seeing a little bit of a plateau with that, but it's also allowing us to be able to accept from patients from the communities surrounding downtown Toronto. So in some of the conversations that I've had with my colleagues here, that we're in a position to perhaps accept from outside hospitals.
Okay. So, you say that the system needs a break. You and the second team from Newfoundland and Labrador has come here, has provided some of that. But your time is at an end. You're going to be going back to St. John's soon. I mean, would you consider coming back, doing another stint here, or maybe even considering another province? Because when we look at the numbers in Alberta, it's kind of grim out there too.
It is. Yeah, I would consider helping wherever and whenever I'm needed. That's what we do, and it's a real unique situation that we're in, to be able to go from province to province to help. And hopefully this is a bit of a template for us to be working together as a country, and not just provincially, but to be able to help each other when we need to.
Okay. Dr. Allison Furey, thank you for your time. Thanks for coming up to help out, and have a safe trip home.
Thanks very much. Have a great day.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.